Hello and welcome to our presentation on the North Carolina Physical Therapy, Supervision and Delegation to Assistants and Aides. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The PT shall determine the patient care plan and the elements of that plan appropriate for delegation. The PT shall enter and review chart documentation, re-examine and reassess the patient, and revise the patient care plan if necessary based on the needs of the patient. The PT shall establish a discharge plan that includes a discharge summary or episode of care for each patient. The PT's responsibility for patient care management includes firsthand knowledge of the health status of each patient and oversight of all documentation for services rendered to each patient, including awareness of fees and reimbursement structures. The PT shall determine that those persons acting under his or her supervision possess the competence to perform the delegated activities. The PT shall provide all therapeutic interventions that require the PT's expertise and may delegate to a PTA or aid the delivery of service to the patient when it is safe and effective for the patient. A PT shall clinically supervise only that number of assisted personnel, including PTAs, aides, and students completing clinical requirements, as the PT determines is appropriate for providing safe and effective patient interventions at all times. The PTA may assist in the practice of physical therapy only to the extent allowed by the supervising PT. The PTA may make modifications of treatment programs that are consistent with the established patient care plan. The PTA may engage in off-site patient-related activities that are appropriate for the PTA's qualifications and the status of the patient. The PTA shall not engage in practices requiring the knowledge and skill of a PT. The PTA shall not engage in acts beyond the scope of practice delegated by the supervising physical therapist. The PT can be off-site when a PTA is treating a patient, but the PT shall be immediately available in person or by telecommunications to the PTA supervising an aide or student engaging in patient care. If a PTA or physical therapy aide is involved in the patient care plan, a PT shall reassess a patient every 60 days or every 13 visits, whichever occurs first. The PTA must document every intervention, which must include the following elements: authentication, signature, and designation by the physical therapy assistant who performed the service, date of the intervention, length of time of the total treatment session, patient status report, changes in clinical status, identification of specific elements of each intervention provided, frequency, intensity, or other details may be included in the plan of care, and if so, do not need to be repeated in the daily note, equipment provided to the patient, and response to treatment based on subjective and objective findings, including any adverse reactions to an intervention. A PTA may document care provided without the co-signature of the supervising PT. Licensed PTAs should be required to wear an identification badge or other form of identification displaying the name of the person and level of licensure. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients, though therapists will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. An aide may perform physical therapy-related activities which are assigned and are commensurate with the aide's training and abilities. An aide may perform only those acts delegated by a licensed physical therapist or PTA. An aide's work shall not include the interpretation and implementation of referrals from licensed medical doctors or dentists, the performance of evaluations, the determination and modification of treatment programs, or any independent performance of any physical therapy procedure. A physical therapy aide must not be independently responsible for a patient's caseload. On-site supervision by a licensed PT or PTA is required for aides. A PT who is supervising an aide or a student shall be present in the same facility when patient care is provided. An aide must work under the supervision of a licensee who is present in the facility. This may extend to an off-site setting only when the aide is accompanying and working directly with the licensee with a specific patient. A PT shall be immediately available in person or by telecommunication to a PTA supervising a physical therapy aide or student who is engaging in patient care. Aides should always be identified as aide, PTA, physical therapy aide, clearly on the name tag. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.